Hello and welcome to this video all about why the anti-aging or longevity industry seems so messy and how you can go about navigating it more effectively. Expect to learn 4 key reasons why longevity medicine or anti-aging is confusing and littered with scant amounts of insufficient evidence, and how I would suggest going about navigating the murky waters. As this is simply my personal opinion, you can take what you like and disregard the rest. 1. There's just no time to wait for answers. Human randomized control trials are the backbone of modern medicine. It's a scientific method of testing doing something versus not doing something on a specific group of people and measuring for a specific outcome. And it was the invention of this formula of testing that dragged medicine out of the dark ages. Now, the reason for the lemons and the limes? A brief history lesson. The first ever randomized control trial, way back in 1747, was performed on a British Royal Navy ship by a ship's surgeon, James Lind. Back then, sailors died of scurvy all the time, but we didn't know that a deficiency of vitamin C caused the uncontrollable bleeding and melee of unpleasant symptoms that eventually led to death. Heck, we didn't even know that vitamins were a thing. Nevertheless, James Lind discovered, by splitting 12 afflicted sailors into 6 groups of 2 and giving each different group a different daily drink, with one pair receiving a glass of seawater, one pair getting a glass of vinegar, another getting cider, and another receiving 2 oranges and a lemon. And 2 other groups received totally ineffective treatments. Also, by the end of 1 week, the pair receiving the citrus fruits, which were high in vitamin C, found themselves well enough to nurse the other sailors. James Lind found the cure for scurvy before we even knew vitamin C existed. This is an example of randomized controlled trials giving us the ability to test treatment effectiveness in humans even when we cannot comprehend how or why something works. This seems to tie in nicely with aging, which is a more complex multifactorial problem than we would like it to be, except for one crucial problem. Human RCTs looking at lifespan literally take a lifetime to complete, so we'd be dead by the time the results are in. This forces us to accept that this emerging branch of science and medicine will not be as robustly evidenced as branches of medicine looking into cures or alleviating treatments for short-term conditions like a flu or a urinary tract infection. Instead, we are left scrambling around in the dark, making informed best guesses from available data collected from other animals with shorter lifespans and/or from lower quality study types, surveying the small population of elderly and aging humans that have already started taking anti-aging medications. Problem number 2 is that it's hard to study aging directly because it's not formally recognized as a disease by the World Health Organization or the American Medical Association or practically any other medical institution, despite the Oxford Handbook for General Practice defining aging as a gradual series of changes over time leading to loss of function of organs and cells with the eventual outcome of death. Until recently, there was a similar issue with designing and getting funding and ethical approval for obesity studies, as it was regarded similarly not a disease of itself, just a major cause or risk factor for other serious diseases. Now, aging is obviously a major cause of lots of unpleasantness and reduced quality of life, yet because of its characterization, it's hard to get ethical approval and funding to study it directly. So, as was the case with Ozempic, before the American Medical Association recognized obesity as a disease, we find ourselves searching around for scraps of evidence that are produced as byproducts of studies that often include specific populations afflicted by specific conditions that tend to make results poorly generalizable to the general public and those of us that aren't afflicted by the same condition. This happened with Ozempic, which was originally studied exclusively in populations of people with diabetes, and a similar thing happened with metformin, which is one of the most commonly prescribed off-license medications used for anti-aging. And the only reason we know that it might be useful as an anti-aging drug is because of a trial that compared metformin with another anti-diabetic treatment, sulfonylurea, and third control group of people who didn't have either diabetes or take either of these medications. This study was only organized because scientists were unsure whether sulfonylureas increased the risk of cardiac death or metformin decreased the risk of cardiac death in patients with diabetes. The third reason why the anti-aging or longevity industry is difficult to navigate and fraught with potential bogus products or snake oil is that fear drives irrational behavior and consumption. And when some of us start acting irrationally and making poor decisions, it creates a social proof that might encourage others to also follow suit. Imagine You're stood on a cliff top, separated from safety by a narrow walkway, with a precipitous and probably fatal drop to both sides. A cat strides across the walkway towards you. In response, you might do one of a few things. You might do nothing. You might step over the cat, or you might even beckon it towards you, bend down and stroke the cat. You can do all of these things because you don't fear the cat. Now let's imagine we stick some saber teeth and 200 pounds of muscle onto our cat and make him a saber-toothed tiger. What will you do this time? Perhaps you'll attempt to run past the tiger, maybe jump over the tiger, or maybe something else. The point is, fear is a very effective motivator of increased risk-taking behavior because we can more easily justify very risky behaviors if they are seen to help us avoid something awful. When it comes to aging, fear is likely at play for a lot of us, and it certainly is with me. How this relates to the anti-aging industry is in the supply and demand. Those of us that fear death and the associated bodily decay that comes with aging, or at least find the prospects of both to be undesirable, demand solutions and are somewhat desperate for them. And unfortunately, no satisfactory solutions currently exist, so we will pay for the least unsatisfactory solutions available. And our rational and pragmatic fears of the inevitable consequences of aging, increased risk of seriously tough chronic diseases and eventually death, can drive us to make irrational, unpragmatic purchases. This in turn drives more and more sales of unproven treatments, giving the industry a real Wild West feel, because that is what it is. Problem number 4 is that the cosmetics and aesthetics companies would really quite like you to conflate looking young and healthy with being young and healthy. This can be distracting and misleading for you and very profitable for them. For example, they might market face creams and ointments as anti-aging, but really they should just be called anti-wrinkle. This is a big problem for 2 reasons. Firstly, each of us has a finite amount of time, effort and money we can throw at combating the myriad issues that come about with aging. Cosmetic companies would gladly monopolize all of our resources to spend on their products, addressing only the visible portion of aging. Secondly, we're at risk of conflating having done something with having done enough, potentially leading to a cognitive error called satisfaction of search. If the cosmetic treatment works and we look as if we are not decaying with age, then we may be able to tell ourselves that we must not be decaying with age after all. So those are 4 big issues as I see it, murking the waters of the anti-aging or longevity space. It's not an exhaustive list, and you'll perhaps have some more important issues of your own, which I'd be interested in hearing about in the comments below. Next, on to what we can do about it. I've split this section into 2. Firstly, an overall strategy or set of principles we might wish to adopt, and secondly, some specific techniques we might wish to consider. One of the big problems here is that the cautious, tentative approach of being a late adopter, i.e. someone who patiently waits for the evidence to come in by watching others take the treatment and either receive or fail to receive the intended benefits, plus or minus unintended consequences and side effects, before taking the leap, can't be applied to anti-aging and longevity unless you're happy to take the alternative route of aging as your parents and grandparents did before you. Now, if that's you, feel free to sit back and await further data, but you might be waiting a lifetime and you probably wouldn't have made it this far through this video if you're in that boat. So be skeptical of outlandish claims and seek out further evidence to support or refute these, but be optimistic that something worthwhile may come along or may have already come along. Many boats will leave the harbour, and we can't know precisely where all of them will land, but if we're too cynical, then we'll have lots of opportunities to feel intellectually smug and superior, but we won't get on any of the boats, some of which might be heading to a destination we'd like to go to. Consider also hyperbolic discounting, which is the fancy economist's term for preferencing short-term gains over long-term gain. Obviously, longevity is more of a marathon than a sprint, and some things that might be short-term disagreeable may grow on you with time, or something that's suggested to be effective might be worth taking even if the short-term consequences are mildly discomforting. And of course, some of the potential levers you can pull will be both a short and long-term win. And finally, some specific techniques. Do the things that are cheap, easy to do, and hopefully pleasant and tolerable. Get some cardiovascular exercise regularly, sleep well if you can, and build and keep hold of some skeletal muscle, as that'll get harder and harder to do as we age. And if it seems of interest to you, consider intermittent fasting because, as with many of the anti-aging medications, it seems to go quite well in mice, but we don't quite know if it's up to the task for us humans. Step 2, avoid the unnecessary accelerators of aging. So too much sun exposure, smoking, and type 2 diabetes, which though they don't make you chronologically age, can all increase the rate at which the cellular processes that cause age-related damage occur in the cells. Step 3. Appraise and reappraise your appetite for personal risk, both for taking anti-aging treatments and perform the same risk versus reward assessment for choosing not to take the treatments now. Step 4. Stay inquisitive. Things will change and more information will come to light as this area of medicine burgeons, but remember, we can't wait forever. That's the end of the video. Thank you for watching.